cautery is rarely used in modern operating rooms. So whatever we are using in our ORs are not cautery. So when we are asking for it, it means that we are not using the appropriate term. What is cautery then? It refers to the heating of a conducting metal until it has reached a sufficient temperature so that the iron glows red. It is something similar to this iron poker, like we heat it either in a with a fire or coal, or there is something similar electric device here in the another side there, and here what happens that electricity is used to heat this tip of this device. So the heated part is then heated device is this then makes a direct contact with the tissue and we get the desired effect. So this is cautery, that the device is heated first and then that heated tip is applied to the tissue. And this is what we are not using in our modern ORs. So what are we using is electrosurgery. So what is the difference? During electrocautery, current does not enters the patient. So the device gets heated outside and it comes in contact with the patient. Only heated wire or device comes in contact with the tissue. But the other term, the electrosurgery, the correct term, what happens here is the patient is included into the circuit and the current actually enters the patient's body. So these are the contemporary microprocessor controlled electrosurgical units. So we should call it this machine not cautery machine, we should call it electrosurgical units or electrosurgical machine, whatever. So these are the microprocessor controlled machines which are available in our ORs. So what is electrosurgery? Electrosurgery is the use of radio frequency alternating current to raise the intracellular temperature in order to achieve vaporization or combination of desiccation and protein coagulation. So electrosurgery is a use of radio frequency alternating current, not the use of heated device. So this is the difference. So what does this machine do? These machines they convert the 60 Hz alternating current which is supplied by to our household or our hospital to the frequency of 500,000 Hz. So the 60 Hz current which comes from the power outlet, that is once that enters this machine and comes out to that our monopolar or bipolar tip, it becomes 500,000 times frequency. So this is actually what is happening. Whenever we are activating our device, the current actually is flowing through and fro to the patient, and because it is an alternating current at a frequency of 500,000 times, so every second we activate the device, what happens? This current frequency and this polarity is changed 500,000 times per second. So if the current is actually flowing through the patient, but why is the patient not getting electrocuted? Or why is not patient or the person is having this neuromuscular stimulation? So that is because at this frequency, that is the 500,000 times frequency, there is no neuromuscular stimulation. The neuromuscular stimulation start to cease beyond 100 kilohertz. The neuromuscular stimulation starts to diminish. So at this radio frequency alternating current, there is no stimulation of nerve and muscle. So there is no question of electrocution here. Now we want to cauterize a vessel, or we want to seal a vessel or a tissue or cut, but we are using a current. So how we are getting this desired effect? So what is happening when we activate this device? Because of change in polarity at a frequency of 500,000 Hz, every time we activate the device, what is happening? There is movement, random movement of the intracellular ions within the cells. So what happens? Because of that movement within the cells, there will be production of heat. So the electric current which is flowing through the cells, they are what are they doing? They are converted into mechanical energy of the movement of the ions within the cell, and that mechanical energy due to friction will generate heat, and that we get the desired effect. So what is happening? There is conversion of radio frequency electromagnetic energy to the mechanical energy, and then we get the desired effect. Now we see the impact of elevated temperature on the cells. What happens when the temperature is elevated? Like when the temperature is reached around 60 but less than 100 degree centigrade, there is desiccation. Desiccation means there is drying of the tissue or cells. There is loss of water, cellular water through the damaged cell wall. And when the temperature reaches 100 degree Celsius or more, 100 degree is a boiling point of water. So there is the cell, water within the cell that will be vaporized. So we also see the smoke and all coming through the tissue. The intercellular water turns into steam. There is a massive expansion of the intercellular volume, and the cell explodes in the cloud of steam, ions and organic matter. So this is in summary. When the temperature is around 50 to 90 degree, there is like desiccation and protein coagulation, and when the temperature reaches 100 degree or more, there will be vaporization. Now there are something we call something monopolar, bipolar. Let's see those terms. This is electric current through a monopolar circuit. What is happening is like we have an active electrode in our hand, and there is one dispersive electrode which is placed in the different parts of the patient's body. So actually the current is like coming through this active electrode, enters the patient body, and then go back to the machine. So, and this thing alternates at a 500,000 times per second. So while it alternates, the current will flow in this direction and it will go back from our active electrode. And so that's happening rapidly. So this is a monopolar setting. So actually what is happening even in monopolar setting is that the current is flowing from one electrode to another electrode, which are placed separately. So let's see what we call our bipolar device. What happens is there, like the two tips are placed nearby, two electrodes. Like in a monopolar setting, we have one active electrode in our hands and dispersive electrode is a little far away. In the bipolar setting, it will be nearby. So the current will actually flow from that electrode to these nearby electrodes alternatively, and the tissue between these two electrodes, there will be they will get the current, and the movement of ions will occur in that, and will get the desired effect there. So only thing is that in both in monopolar and bipolar, there is flow of current from one electrode to another. So actually both are bipolar. So again, the term monopolar and bipolar is also not appropriate, because both are bipolar. Single polar electric surgery does not occur. So only difference is that the placement of dispersive electrode, it is nearby in a bipolar handheld device, whereas in a monopolar system, what we call monopolar system, the dispersive electrode are a little away. So actually both are bipolar. Now we know that current is flowing from both electrodes, dispersive electrodes and active electrodes as well. So why we get desired effect only in our hand device, not in a dispersive device or dispersive electrode? This is something similar to this experiment. It's the matter of energy density. So our active electrode or handheld device, the point is sharp, and the tissue it comes in contact has the highest energy density. So this is something similar to this experiment, like if we put a lens and concentrate all the energy from the sun at a point, the paper will burn. And so something similar concept is there. So that we all get the desired effect because of energy density. Now we have seen various modes of electrosurgical units. Let's discuss very simple ones. All of us must have heard about cutting mode, or cut mode, or coagulation mode. What does this mean? What actually this means is cut mode is when we activate the device in a cut mode, there will be low voltage continuous outputs. Here, if you can see this diagram over there, here there will be continuous flow of current during the cut mode. So the voltage is kept low. Whereas in coagulation mode, what actually happens is that there is intermittent flow of the current. The current does not flow continuously. So there is one burst of current. So there is then there is a gap, and then again second burst of current comes. So this goes on. So what actually happens in coagulation mode is that only 6% of the time we activate the device, the current flows. So 94% of the time the current does not flow in coagulation mode. Suppose we activate the device for 100 seconds, actual current flow will occur only for 6 seconds. So this is the difference. Whereas in cut mode, what will happen? If you activate the device for 100 seconds, the current will be flowing for 100 seconds. So what is the difference? Why do we require these different types of mode? So this is because the difference in flow of current has different effect in the tissue. So this diagram is showing the cut mode. Here if you can appreciate the diagram here, it's a continuous flow of current. There is like this smooth kind of tissue effect is achieved. Whereas in coagulation mode, in the same electrode is activated, the current we see the difference. There is like inhomogeneous effect into the tissue. The smoothness is not there. So this is because once we activate the device, current flows, and that cause a brief and superficial elevation of temperature sufficient to cause focal coagulation desiccation at the surface. So what happens that the next time the current comes, it comes for 1 second, and there is a gap, and next time when the current comes, the impedance or resistance of that tissue, which is already charged because of first wave of current, is increased. So the current cannot go deep. So what will happen? It tends to go laterally. So this is the different effect of coagulation and cutting. This I think we can skip. So this is again the same thing. If we use the cutting mode, there will be smooth homogeneous effect into the tissue, whereas in a coagulation mode, there is inhomogeneous, and we know why, because the flow of current is intermittent, and there will be effect of the first wave of current, second wave of current on the third wave, and so on. So for sealing a vessel, which one will be appropriate, cutting mode or coagulation mode? So to seal a vessel, cut mode is better. So cut mode is a misnomer again. It has been proposed initially when the machine was devised, and it's going on. So cut mode is not for cutting only. So it is actually better for sealing the blood vessels. And some machines have blend mode, different kinds of mode. That depends upon the manufacturer. So they may have different kind of other modes, and we should actually know, have a concept of cut and coagulation. Blend modes are like modulation of these two modes. Like in actual coagulation mode, its current flows only for 6% of the time. In the blend 1, 2, 3, that can be 50-50, 25-75, and that depends upon the manufacturer. Now in this animation we can see what is the effect of different modes once again. Here the current is flowing continuously and we can see this is the desired effect. This must be something blend mode. We see that there is some lateral effect as well. And this is the coagulation mode. Here we see that there is lateral burn a lot as compared to the cut mode. This is again when a different type of device is used. There is homogeneous effect in the tissue. This must be a high modulate. So here is some coagulation type of mode. The the current effect goes more laterally, not deep. And this is a spray mode we do have in our machine. Where again it's superficial charring of the tissue, and the current does not go. The effect does not enter deep into the tissue. So these were the basics regarding electrosurgical units. So there are certain conditions in pregnancy and pediatric surgery. Surgery energy can be used safely in all of the ages and states, but there is a high body surface area to volume ratio as well as elevated total body water contents in pediatric patients. That makes current flow less predictable in children than in adults. So similar redistribution of water also occurs in pregnancy. So this warrants a reduction in energy setting to only that necessary to generate effect. So it is advised that in children and in pregnant patients, the power setting should be on the lower side. So most of the clinicians they advise to use around 50% of the power which we are using in adults. There are some advanced energy devices available nowadays. We'll discuss, we'll introduce some few brief about few devices which we have in our institute. So this is the ultrasonic instrument. This is what actually happens here is this is some harmonic scalpel we have, and other companies they have different name for it. So actually ultrasonic devices offers an alternative to the electrosurgical instruments. Here actually the current does not flow. The tip of the device, this is the tip of the device that vibrates at a frequency of 55,000 Hz, and that vibration will produce the heat within the tissue that is grasped between its jaw, and that heat is again will have a desired effect. The heat depending upon the temperature which is reached. So in this advanced energy device, ultrasonic device, the sound waves are used and at a frequency of 55,000 Hz, but we don't hear the sound. Why so? Dr. DC will actually. So this is beyond our audible range. So I think it's 20,000, I guess. We can hear, because it's beyond our audible range, so we don't hear it. But actually, it's sound waves. The tip is vibrating, and that is producing the heat. And we know how heat affects the tissue. So other are advanced bipolar devices, like we have brand names from different companies like Ansil and Ligashore, etc. They use bipolar energy, this continuous low voltage energy to seal the vessels. So these are some. They use a similar energy as the electrosurgical units. And there is another device, is commonly known as CUSA. It's a Cavitron ultrasonic surgical aspirator. So it's again ultrasonic device. So there is vibration at the tip of the device, but there is a Cavitron effect. What does that mean is that it is a process of formation of vapor phase of a liquid when it is subjected to reduced pressure. The tip of the device creates a reduced pressure wherever it is activated or applied to the tissue. So reduced in pressure will do what? The boiling point of the tissue is decreased. So in normal atmospheric pressure, the boiling point of the water is 100 degrees. So whenever that atmospheric pressure is reduced, water will boil at a much lower temperature. So this is the principle of this process. So thus it is a process of boiling a liquid due to pressure reduction rather than heat addition. So even at a low temperature, we will get the desired effect of vaporization. This is the tip. These are different things. There is the tip vibrates. There is irrigation. There is suction. So it's all in one type of tip. And what is the advantage is that there is lateral. So low heat is used. Lateral damage will be less, and then it makes surgery safer, especially for deeper lesions located around the important structures and vessels. So basically used in liver surgery, even in neurosurgery and other places where we need to safeguard important structures and vessels. Another device is argon plasma coagulation, APC. It is again an electrosurgical device, but a monopolar type basically. What is it is used to achieve superficial hemostasis. When we don't want our electrosurgical effect deep into the tissue, we use APC, following liver surgery, or when suppose in the intestine there is a bleeding vessel. So monopolar or this bipolar system, they might penetrate the tissue. The wall thickness of the intestine would be few mm. So that may be dangerous. That may lead to perforation. So in that time, at that area, APC can be used because the penetration range is usually 1 to 3 mm only. So only superficial effect will be there in argon plasma coagulation. What does it do? It is like argon is an inert gas and it can be easily ionized. The current actually flows through the ionized argon gas, not directly to the tissue, and that helps us to make it superficial only. So there is no heat dissipation beyond 3 mm. The major benefit of this technique is that it is a quick method of therapy delivered over a large area of treatment. Can be used. It is a non-contact method delivered via accessory channels in endoscopy, and even in open surgery or laparoscopic surgery we have its probe. So this is the tower or machine or unit, and this is something the non-contact technique. The current is flowing through the argon liquid, so there is only effect in the superficial area. Thank you. This is in brief regarding electrical energy